Every 2 seconds, someone in the United States needs blood, yet less than 10% of eligible donors actually donate. Imagine that. The life-saving crimson liquid coursing through our veins is in high demand, and yet the supply falls woefully short. Now, you might be thinking, well, I've donated blood before, I've done my part. And to that we say, bravo, you are among the few. But here's something that might catch you off guard. Most of the blood that is so generously donated doesn't end up directly saving lives as you might think. Instead, it finds its way to a rather unexpected place: pharmaceutical companies. That's right, the majority of donated blood is sold off to drug manufacturers. So, what happens to all that donated blood? How does it end up in a pharmaceutical lab instead of a hospital? Buckle up for a journey that might surprise you. Once you roll up your sleeve, the journey of your blood donation begins. Every drop of blood that's generously given embarks on an incredible voyage, from the body of the donor to the recipient in need. Let's start from the very beginning, shall we? The first step in this process is the screening. Potential donors are asked a series of questions to ensure their blood is safe to use. This includes questions about their medical history, lifestyle, and recent travels. It's an essential step in making sure that every drop of blood collected is as safe as it can be. Next comes the collection phase. This is where you, the donor, take center stage. A needle is carefully inserted into a vein in your arm, and blood is drawn into a sterile bag. This process typically takes about 10 minutes, and about a pint of blood is collected. Don't worry, your body will replenish this in no time. Then it's on to testing. Every donation is rigorously tested for a variety of infectious diseases, including HIV and hepatitis B and C, among others. This to ensure that the blood is safe to be transfused to patients. Once the testing is complete, your blood is then separated into different components: red cells, platelets, and plasma. Each of these components serves a unique purpose and can be used to treat different conditions. For instance, red blood cells are often used in surgeries, platelets can help cancer patients, and plasma is used for burn victims. Lastly, your blood is stored until it's needed. Red cells are stored in refrigerators at a temperature of 1 to 6 degrees Celsius for up to 42 days. Platelets are stored at room temperature in agitators for up to 5 days. Plasma, on the other hand, is frozen and can be used for up to 1 year. And there you have it, the journey of your blood from donation to storage. But remember, this is just the beginning. But the journey of your donated blood doesn't end there, far from it. Did you know that donated blood is a billion-dollar industry? Intriguing, isn't it? The very life essence that courses through our veins, the crimson tide that keeps us alive, is a hot commodity in the world of business. But who's buying, you ask? The answer is pharmaceutical companies and medical facilities. These entities are the main buyers of donated blood, and they're willing to pay top dollar. But why? What makes blood such a lucrative business? The answer lies in the unique properties of blood and its components. Blood is more than just a red bodily fluid. It's a complex mixture of cells, platelets, and plasma, each with its own vital role in the human body. This complexity makes blood and its components incredibly valuable in research, testing, and treatment of various diseases. Pharmaceutical companies use donated blood in a wide variety of ways, from developing new drugs and vaccines to testing their products' safety and effectiveness. Blood is an indispensable resource. Medical facilities, on the other hand, need a constant supply of blood for transfusions, surgeries, and treatments for conditions like anemia and cancer. Now, this might raise some eyebrows. After all, when we roll up our sleeves and donate blood, we're usually not thinking about its monetary value. We're thinking about the lives we could potentially save. So the fact that our blood is being bought and sold might seem a tad unsettling. But before you jump to conclusions, let's consider the ethical considerations. The sale of blood is heavily regulated to prevent exploitation and ensure safety. Donors are not paid for their donations, and the blood is sold at a price that covers the cost of collection, testing, storage, and distribution. In other words, the sale of blood is more about recovering costs and ensuring a stable supply than making a profit. So while the business of blood might seem like a strange concept, it's a necessary part of our healthcare system. It ensures that when someone somewhere needs a transfusion, the blood is ready and waiting. Now you might be wondering, where does your blood go once it's sold? Your donated blood might end up in a place you'd least expect, the pharmaceutical lab. A curious turn of events, isn't it? This isn't a dark, clandestine operation, but rather a crucial part of modern medicine. Pharmaceutical companies are in the business of developing new drugs, treatments and therapies. To do this, they need human blood. Why, you ask? Well, human blood carries essential components like plasma, red and white blood cells, and platelets that can reveal a lot about the human body's response to different substances. Imagine a team of scientists in a lab, peering into microscopes, observing how a new drug interacts with human blood cells. They're studying the impact of their new creation on these cells, looking for any adverse effects or promising results. It's a bit like a culinary test kitchen, but instead of tasting new recipes, they're testing the potential of new drugs on our life-giving fluid. Now let's take a step back and look at the big picture. The blood you donate doesn't just go into a single test tube for a single experiment. It's often divided into its component parts, creating a veritable buffet of cells and plasma for various research projects. Your red blood cells might be used to test a new treatment for anemia, while your plasma could be helping scientists understand more about clotting disorders. And your white blood cells, they could be instrumental in developing a new vaccine. It's a fascinating process and one that's underpinned by the generosity of blood donors like you. Every vial of blood, every test tube can help advance medical science and potentially save lives. So, how do these pharmaceutical companies get their hands on this precious resource? They buy it. Yes, your donated blood is usually sold to these companies by blood banks. It's a necessary step to cover the costs of collection, testing, storage and distribution. This might seem a bit commercial, but remember, it's all in the service of creating better, more effective treatments for a whole host of diseases and conditions. So, next time you see a new drug on the market, remember, your donation might have played a part in its development. Your gift of blood doesn't just save lives directly, it's also at the heart of medical innovation. So, we've established that your blood donation can end up in places you didn't anticipate. But what does this mean for you, the donor? Firstly, let's address the elephant in the room. Yes, a majority of donated blood does find its way into the hands of pharmaceutical companies. But that's not the complete picture. Your blood donation plays a pivotal role in medical advancements and breakthroughs. Imagine for a moment a world without vaccinations, without advanced treatments for complex diseases such as cancer or heart disease. It's a grim picture, isn't it? This is where your blood donation steps in. It's not just about the immediate need, it's about the future too. Each drop of your blood contributes to the development of new drugs, therapies and treatments that save millions of lives. But let's not forget about the immediate impact of your donation. Every 2 seconds, someone in the world needs blood. That person could be a car accident victim, a cancer patient, or a mother giving birth. Your donation ensures that these individuals have a fighting chance at life. It's a lifeline in emergencies, a beacon of hope for those in dire need. From a broader perspective, your donation also has a profound impact on the medical community. It provides doctors and scientists with the resources they need to carry out their life-saving work. Your blood is a key component in medical research, helping to unlock the mysteries of the human body and find cures for diseases that were once thought incurable. So while it's true that your blood might end up in a pharmaceutical lab, it's crucial to remember the positive impact of that journey. Your blood donation doesn't just save lives in the here and now, it paves the way for a healthier future for all of us. In conclusion, donating blood is a selfless act of kindness. It's a simple act with far-reaching implications, touching lives in ways you might not even realize. So the next time you donate blood, remember you're not just saving lives, you're advancing medical research.